So the question is, what are the sources for stem cells for patients receiving haploidentical transplantation with post-transplant cyclophosphamide? And we have two options. One is a bone marrow graft. Second one is a peripheral blood graft. And it is now accepted that the peripheral blood graft is associated with a high incidence of both acute and chronic graft-versus disease. And although the survival is not different compared to bone marrow, there seems to be a better quality of life because of lower chronic GVHD. And there is actually a study done in matched unrelated donor transplants in the past, recent past, published in JAMA Oncology by Stefan Ciurea and colleagues, which showed fairly clearly that because of chronic graft-versus disease, more people are able to return to work. They have a better functional life and are more likely to return to work if they receive the bone marrow graft. With these things in mind, our group has preferentially used a bone marrow graft as source for stem cells. We see very little graft-versus disease. And in addition, the biggest advantage in our opinion is the possibility to use cellular therapy after transplant to enhance graft-versus tumor effect. And if a patient would develop significant graft-versus disease, we need to be on steroids. Cellular therapy is not possible at that point. In addition, about 15 to 20% patients receiving peripheral blood stem cells may develop significant cytokine release syndrome, and this is associated with a high treatment-related mortality in the range of 30 to 50% in the first 6 to 12 months post-transplant. So again, we still prefer bone marrow as a source of stem cells. The problem is a little bit more difficult to get. Patients donors need to go to the operating room. The procedure takes about 2 hours. And in majority of centers, because of it's time-consuming, doctors prefer to avoid doing this procedure. Again, we believe that still a bone marrow graft is the best source of stem cells for these patients and probably for transplanted patients in general.